Hey, I'm Dr. Seiler from Seiler Skin in Birmingham, Alabama, and we're going to shoot a video today of the Vampire Facelift. This is going to involve us using Juvederm Volume in the cheeks to give our patient here a good lift to her cheek. Regular Juvederm around the mouth to help increase the volume around her mouth and some fine lines. And then we're going to complement that with what we call PRP, or platelet-rich plasma injections, to really help stimulate collagen and to help her with some of the acne scarring that she's got. So we're going to kind of do this in a little series here all together. So you'll see us jumping around a little bit here, but we're going to start with the cheeks. Adina, my assistant's going to ice a little bit. We're going to start right here in the middle part of her cheek to give her a little bit of a lift. And we do a little bit of icing before to not only numb the skin, but help to reduce any bruising, which is usually pretty minimal from this procedure. And then, as you've seen in some of our other videos, we have a little device called the AccuVein, which we really can see little vessels on the skin to make sure that I don't hit anything that can bruise. So you'll feel us doing that next here. And this doesn't hurt, so she doesn't even really feel this little... Alright, so we're going to do this next. Alright, so this is going to be a couple little injections here of Voluma. And she's already had some numbing cream on, so she might feel just a little pinch when we're under the eye. This really shouldn't hurt too much. You okay? Mm-hmm. This is her first time to have any injections done, so she's new to injections. We already did some Botox for her in the first time up in her forehead, between her eyes and around her eyes. And the purpose of these injections is to really help to give some volume back to the cheeks, to help lift the cheeks so that you don't really see the what we call the nasolabial fold as much. Alright, let's look right here. Very good. This device we've had for about 2 years now, but it really helps me avoid the little bitty vessels on the skin so that the patient doesn't bleed, and that way it really reduces the risk of bruising. So we just kind of follow the cheek here to augment the cheek, like I said. So we're going to go ahead and finish off the cheeks. I wanted you to be able to see how easy this is to get through. And here in a second we'll come back and you'll see us injecting some Juvederm around the mouth. Alright, so now we're going to complete the left cheek injection of Voluma here. We've already done the right cheek. It's probably a little hard to tell on camera, but we've gotten a nice lift in the left side of, or excuse me, the right side of her cheek. Again, we're using this little AccuVein to make sure we don't see any little bitty vessels. We're going to go a little higher on this cheek. She's a little asymmetrical, but we're going to fix that. So, how's that feeling? You feeling much? And sometimes we do a numbing shot through the mouth, like a little dental block in patients. We did not do that in her. We just used some topical numbing cream, which really kind of takes the sting out. So even though it's several little injections, usually patients tolerate this fine without any problem at all. All right, let's look right there. So this is just a series of injections to bring the cheek up. And like I said, here in a minute we'll do some Juvederm around the mouth. So we'll finish off this cheek, and next you'll see us doing the Juvederm around the mouth here. So I just wanted to really show that this is a very tolerable injection. Patients are afraid to get filler, and understandably so, but if it's done right, this can be a very tolerable treatment for the patient and does not have to be painful at all. So, alright, so now we're going to do a little bit of Juvederm around the mouth. We've already gotten a pretty nice lift with just a little bit of volume in the cheeks. And you can see that she hadn't had any bleeding, so she shouldn't bruise at all from the Voluma injections. Again, we've done this without a numbing shot. She's going to go have lunch after this, so we're trying to not do any numbing, so you might see just a little movement when we do this, because sometimes you just feel the initial little prick here, but it's usually not too bad. This little wiggle I do usually is enough to... Do you feel that much?
I don't feel it at all.
Good. Usually you feel the first little stick, and then the lidocaine from the Juvederm starts kind of kicking in. So when we were finishing up the cheek a minute ago, she asked a really good question: what's the difference between Voluma and Juvederm? So the main difference in layman's terms is Voluma is chemically bonded stronger. It's a mixture of long and short chain hyaluronic acid, and so it's a tighter gel. So the body doesn't break it down as much, even though it's naturally occurring in the body. All right, a little stick here. So it sits on itself better, basically, and so you can get a better lift in the cheek it lasts longer. So Voluma lasts about 2 times as long as Juvederm does. And that's why we use it in the bigger areas like the cheek and under the eye to give a better lift. And then when we want tissue expansion around the mouth, where we put the Juvederm a little bit more superficially, that's why we use Juvederm. So it's a great question to explain to the audience on video here. Alright, let's ice down here just a little bit. We're going to do a little bit down in the corners of the mouth here. Try to get this good and numb with the ice. And after we do this, we'll finish off the left side, and then we'll start to do the little PRP injections. So let's watch us do this real quick here. Alright, let's take a look again with our AccuVein to see if there's any little, so we see a little blood vessel right there, so I can go right behind it so I don't make anything bleed, even if I'm kind of pinching here a little bit. You okay? Mm-hmm. So for those of you watching, hopefully you can see that this is a pretty easy treatment to do. Every now and then the patient will feel a little bitty stick, but it shouldn't be anything bad. I'll hold a little pressure afterward to make sure they don't bleed here. So, alright, we'll continue on in a minute with the PRP injection sheet first. Alright, so we're going to do the PRP injections. Again, this is the platelet-rich plasma, and as you can see, just so the viewing audience can see, that plasma in PRP is yellow. There's been a lot of videos out of the media that make it all about that we're putting blood back on people's face and it's all bloody, and you've seen the Kim Kardashian videos and all that kind of stuff. This is really much cleaner than you think it is. It does have just a little bit of a sting to it when it goes in, and so you might see Miss Kim wince just a little bit, but it really is quick and over with. Is that okay? Mm-hmm. Sometimes it burns a little bit when it's in there for about a minute. She's not really feeling any burning though. Are you feeling any burning from the first stick?
None at all.
That's good. Sometimes the plasma can be a little acidic and it just causes a little bit of a sting. This is really going to help to add volume to the filler. Little poke here. This helps to really increase the collagen stimulation, which you don't really get that much with filler alone. So that's the reason why the addition of this PRP to the treatment itself, which is why we call it the vampire treatment, or the vampire facelift, is what really helps to stimulate collagen. We're going to really help her with her little bit of acne scarring. Okay, so let's come down here on the ice for just a second. And again, we obtain the growth factor in the PRP from her own blood, so we're using your own stuff. It's done with a sterile FDA-approved process, so it's a very, very safe way to get the high-quality growth factor out of your blood and concentrate it and put it back into your skin for healing and collagen stimulation. Okay. Alright, let's look right here. And I also think that because you do have some hemostatic factors in the plasma, even though you've taken the red blood cells out, I do think it really helps with bruising because it keeps you from overreacting to the treatment. Now you'll see me kind of really fill up this area, and you'll see that she's going to be a little puffy for just a couple of minutes after this. You okay? Mm-hmm. Burning at all?
Not at all.
Okay, good. Usually if you're going to burn and all, you would have felt it already. And the swelling from the actual PRP goes down in a matter of minutes to an hour or so. So sometimes you're a little puffy when we finish. But her skin's tolerating this really well. And you can see that I'm getting this all in these little textural scars and stuff. This might hurt just a little bit. You okay? Mm-hmm. This is really going to help stimulate collagen to help her with her acne scars. And then she's going to do a series of vampire facials after this, which is the microneedling with the topically applied PRP, and we'll inject some PRP again. Once you come from that side and ice under her eye, I'm going to do one little bit under her eye. The other cool thing about this is even though we've already done some Voluma under her eye for volume, we can also inject a little bit of PRP really close under the eye. Usually it's very well tolerated, but it really helps to stimulate collagen and to tighten the skin. It also can really help with vascularity under the eye to help with dark circles and hollowing. So we're going to do one little stick. This is where you can kind of hear it a little bit. So, did you hear any of the other little sticks? Little stick here. Real quick. You might hear kind of a little swish. Do you feel that much? Good. We got really good blood draw from her. She was really easy to get blood from, so we got some good platelets in here. Alright, so we're going to finish off the other side, but this is the Vampire Facelift. So again, this is using 2 different types of filler if needed. Sometimes we just use one or the other, but most of the time we do both Voluma and Juvederm. I've started to add Voluma to the Vampire Facelift, even though the original Vampire Facelift with Dr. Runnels, when he trained me, was just using Juvederm, but I think we get even better results now that we add some Voluma in the cheeks. And if you can get a little closer to her here, just so that the audience can kind of see that, you know, she's got 1 or 2 little places where you can kind of see a little dot of blood, but other than that, she's not going to bruise anywhere. You can see she's just a little puffy through here, where I really infiltrated her acne scars here. But she's going to be fine. She's not going to have any bruising from this, and after about an hour, she'll be pretty much back to normal. She'll look better from the filler, but the results really will come in the next couple of months and just get better and better from the entire process. So you can read more on our information about this. For those of you that might be watching this for training purposes, we do offer Vampire Facelift training courses here at Seiler Skin, so there's information on our website about that. And if you're a patient, we'd love to see you for a consult. So thanks for watching.